Hi, my name's Paul Massara from Mare Stud, and we've been using the Equiloom masks generally on our dry mares, but also on some of our maidens as well. We find the Equiloom to be a very useful operational tool. It allows us to have the mares out in the paddocks and roaming freely, not having to bring them into barns. There are also some financial benefits. Obviously there's no stable bedding, the excess staff used, and obviously transporting the horses in and out on a daily basis. That can be time consuming, and this is money I think well spent to save in those operational procedures.
Blood Horse Plus, available through bloodhorse.com, provides exclusive, timely, and unmatched content to subscribers, including Fox Sports, Blood Horse branded weekly programs, a detailed stakes winners section, behind-the-scenes videos from Blood Horse staff, on-demand access to deeper horse statistics, and a $5 monthly credit to equineline.com. Upgrade to Blood Horse Plus today.
Okay, I'd like to welcome everyone to the 2025 virtual Thoroughbred Owner Conference, and I'm Gary Falter with the Jockey Club, and my apologies for the technical hiccups this afternoon. I think we've got things resolved, and everybody who can get online is able to do so. So this is our third panel this year. We have 10 panels that take place this year, and our full schedule is on our website at ownerview.com, where you'll see the date and the time of all of our monthly webinars. And these panels last about 50 to 55 minutes. And as the panel progresses, if you have a question for either of the speakers, please use the Q&A button. You'll see it at the top of your Microsoft Teams screen. And we'll get to as many questions as we can at the end. So before we get started, like we usually do, I'd like to take a moment and recognize our sponsors, starting with the presenting sponsors. That would be Bessemer Trust and Keeneland and Stoll-Keen and Ogden. And today, our panel sponsors are Airdrie Stud and Equiloom. And the Q&A sponsor at the end of the session is West Point Thoroughbreds. And a sincere thank you to all the sponsors for their continued support of thoroughbred ownership. So thank you very much, sponsors. So today's topic is mare reproduction, and I'd like to introduce our speakers, our panelists today, so we can bring them on. There we go. So start off with Dr. Pete Sheeran. Welcome, Doctor.
Hey, thank you.
Good. So some background about Dr. Sheeran. He's born and raised New York City. First experience with horses was soon after his family moved to LaGrangeville, which is a small town north of the city. Began working on a thoroughbred breeding farm where he gained experience in all aspects of the thoroughbred industry. During high school, he also competed on the varsity crew team, a rowing team, and his love for rowing took him to Syracuse University, where he majored in biology. While in vet school, Dr. Sheeran expanded his interest into theriogenology. Did I get that right?
Sure.
Mare reproduction, okay, particularly in large animals. After graduating from the University of Florida College of Veterinary Medicine in 1994, Dr. Sheeran joined a practice in Live Oak, Florida, and then he joined one of his veterinary school mentors at Rood and Riddle, Dr. Michelle LeBlanc, as a staff theriogenologist. Dr. Sheeran returned to Rood and Riddle and Equine Hospital after closing a practice that he had in Pennsylvania and has been there ever since. So welcome, Dr. Sheeran.
Thank you.
All right, so next with us is Dr. Mariah Schnobrick. Welcome.
Thank you.
And she attended Brown University and the University of Pennsylvania School of Veterinary Medicine. Her internship was at Rood and Riddle Equine Hospital under Dr. Thomas Riddle. And then she then completed a second year as a resident veterinarian at Shadwell Farm there in Lexington with Dr. Riddle. And since 2012, Dr. Schnobrick has worked as a theriogenologist, I'll get this right, at Rood and Riddle Hospital, with the primary focus on problem mares and stallions, and we'll talk about some of that. She practices both ambulatory reproduction, so she's out in the field a lot, and advanced reproductive techniques. Dr. Schnobrick was the first team All-American rower and a member of the U.S. national team. And just talking beforehand, I learned that her husband actually rowed in the Olympics. So a lot of rowing connection here. So welcome.
Thank you.
Thanks.
So we have some video to show the audience, but before we do so, I've got some questions for both veterinarians because we're in that time of year where it's real busy. Foals are being born, mares are being bred for the first time, or maybe for the second or third time. So a lot going on right now. So let's just jump right into some of the questions, and that'll set things up for the video that's to come. So oftentimes an owner plans to maybe retire a nicely bred filly as a brood mare. So once they make this decision, what are some of the steps that an owner needs to keep in mind to prepare that filly for her new career, as she wraps up her racing career?
You want to take it?
Go for it. You go.
So the first thing is going to depend on the time of year that they retire her. So if it's in the fall, you're going to do a reproductive exam. So we'll palpate the mare, ultrasound her ovaries, do a vaginal speculum exam, essentially making sure that all the parts are there. Depending on when it is in the fall, she may not be cycling, as the mares don't cycle year round. They shut down for the winter time. So we'll have to make an assessment then if she's not cycling, does everything appear normal? And then going forward, if they're going to try to get her bred as soon as possible, they'll want to put her under lights. And we usually do that at the beginning of December or right after Thanksgiving. And what putting the mare under lights does is it advances the breeding season. So the mare has a breeding season of 4 or 5 months. And what it does is it takes that breeding season and just moves the whole thing forward so that we can get the mare covered the beginning of February. So we get that January foal. Everybody's looking for the January foal, so they have big strapping colt to run through the sales.
So if it's fall and I've got a filly at the track, I'm going to retire as a brood mare, does it make sense to put her under the lights while she's still at the racetrack? Or would we wait until maybe we retired her in January or February?
So if you want to basically, once you start the lighting program, about 6 weeks after that, they'll begin starting to cycle. Mm-hmm. So if you are not going to have her back until January and she'll be there all of December, I would say you would want to have her under lights. And we usually recommend having the lights on from 4 p.m. to 11 p.m. Or as you saw, there's the Equilume mask, so they could go outside. But that window allows them to have an artificially lengthened daylight, which will stimulate them to start cycling. So if we do see mares that come in off the track in January, and the issue is they usually will not cycle until the normal spring. So they're a month or two behind the mares that were put under lights. So it's important to consider. And maybe one other thing is just plane of nutrition. I think a lot of mares are cared for at the track on a very high nutritional plane. They're also protected from the elements. And so if you kick them out in a field with a group of other brood mares, you may have to baby them a little bit in that transition so they don't lose a ton of weight. Some of them are very thin skinned and it can hit them harder. So just sort of transitioning, maybe considering blanketing, it's very mare dependent, but all things to consider.
Okay. So if an owner decides to retire the filly, they breed her, and he'd like to race her a few more times, is that possible? Is that something that a horse could go on and race while the mare is pregnant?
Yeah. The obviously you're not going to have them racing when they're 10 or 11 months in full, but for the first 60 or 90 days of their pregnancy, it's okay to race them. I mean, the things obviously you want to watch out for is if it's in the heat of the summer, you don't want them to get too heated because that can have an impact on the foal.
Okay. So now let's talk a little bit about pregnant mares. So what's a normal gestation for a pregnancy?
So it's about 342 days. If you looked at the literature, most people go by 11 months, but if you took an average of a bunch of mares or 100 mares, most of them will fall around 340 days. And then it's interesting because mares are consistent within themselves. So if one mare goes 350 days, she's likely to continue to do that the rest of her life. If another mare foals early, she's likely to do that again. And so that may help you in terms of deciding breeding wise, maybe you want to wait till the 30-day heat or later, so that you're not, if she's a mare that goes early, so you're not risking a really early foal around the January 1st time.
The other thing to remember is that the gestation length in horses are variable. I mean, all the other species, it's pretty tight as to when they're going to have their offspring, but in the horse, 30 days one way or another is not uncommon.
Okay. And so what kind of signs does a broodmare manager look for to determine that this mare is getting close to foaling? Is it just counting days and hoping you get it right? Or are there signs that the mare shows to say, okay, it's imminent here in the next few days?
Yeah, so most mares will develop, probably the first thing that they notice is developing the mammary gland. And as Dr. Sharon said, with gestation, that can be variable. The development of the mammary gland can be variable in mares, but starting the first 2 weeks before they're going to foal, you'll see some development. And then usually people are looking for wax, which is a secretion right at the teat, the very tip of the teat, and it looks like a kind of like a white wax. That's why they
Well, I think we have a photo we can bring up on the screen to kind of show the audience what that looks like.
Yes, there you go.
There you go. Okay, so this mare's waxed on both sides, it looks like.
Yes, and you can actually see on the inside of her left leg there's some secretions, which are probably her dripping from the mammary gland. So when you see that, you are thinking that mare's foaling within 24 to 72 hours. It's you watching her closely. And then other signs that you may see is the relaxation of the tail head, the vulva elongates. They're also very large. Those are the things that most people would look at. There are specific tests that you can do on the milk that the mare's secreting that may help give you an idea of how close she is. But a lot of times people just go where they start watching them closely around 320 days.
Okay. And is it safe to say that almost all mares will wax like this?
No.
Do some not wax?
Some do not wax, and then or they'll pop up wax in the afternoon when you bring them in, and they'll foal that night. Then there's other mares that'll have wax for 3 weeks.
Yes.
So
they're very tricky, and anyone who foals mares knows it's so you just have to watch them. Hopefully, if everything's normal, they'll be similar year to year, but we know they can have issues with pregnancy that may make them wax up earlier than they're actually going to foal, especially if they're being treated. Or sometimes we have mares in Kentucky, they'll be on domperidone, which is something to help them with the grass and some of the issues we have with the fescue here. But that may make them secrete milk earlier than they're going to be foaling.
So if a mare is dripping the milk for a period of time, is there a risk of losing some of that valuable colostrum?
Yes. Yep. And so what many places will do with the time that the mare foals is they'll take a sample of that, and you can test it to see the amount of colostrum present in the secretion. And there's a cutoff for good, marginal, and bad. And so if it tests poorly, then that's a mare that you'll probably either bottle feed or tube banked colostrum. So people will collect colostrum from mares that have good colostrum and freeze it and store it. And that can be to the foals, or later down the road, 12 to 24 hours after birth, we can run plasma to the foal.
Okay, very good. Good to know. So how old can a mare still be a productive brood mare? Is there a certain cutoff point where they just won't cycle anymore, or it just doesn't make sense to breed them?
Yeah, so I would say it's sort of breed dependent. Smaller breeds usually can breed older. They're more successful, sometimes into their mid-20s. With thoroughbreds, it is mare dependent. But as you get up into 19, 20, you're looking at sort of, again, it depends on the mare. So what I would say is at 19, you should be assessing the last foal she produced. And if it's a very, in terms of her uterus and aging, there may be factors there that you need to consider. If she's consistently throwing very small, weak foals, she may not be able to support and nourish a pregnancy the way she did earlier. So that's one issue. And that may be sort of the end of her career there. And then the other issue is, conformation, whether she's actually cycling. They usually continue to cycle after, we don't usually see them completely stop cycling as a reason for retiring the mare. It's usually somewhere in the 19 to 20. We bred a mare 24 last year that produced a beautiful foal. So they can go that long, but I would say I've never seen a 27-year-old mare foal. So 24, the long end, but there's certainly mares that have had C-sections earlier, cervical repairs. There's things that limit her reproductive lifespan or make it less likely that she's going to be able to produce every single year. And
I believe the dam of Secretariat Something Royal was 18 when he was sold. So so can we spend just a moment talking about some problem issues with the whole reproductive side? You know, what can cause a mare to, after all your efforts, still not get pregnant?
Absolutely. You want to hit one?
There's a whole long list of things, right? So the first thing is she cycling normally? So does she produce a follicle, ovulate the follicle, and do that at the appropriate times? And can we get to the stallion at the appropriate time? A lot of these horses that are really busy, it's a challenge to get your mare to the stallion at the appropriate time. And then if we look at the uterus, one of the things that we'll see is fluid in the uterus, and which is a small amount is normal and when they're in heat, but a large amount either before or after breeding, that's something that we have to deal with. And then, as Dr. Snowbridge alluded to, issues with the cervix. So if the cervix is damaged, that's going to impact their ability to get pregnant.
Okay. Well, we have an image of fluid in the uterus, and you'd mentioned some of that's okay, but too much is not okay. So what are we looking at here? I mean, it just looks like
that's more pus than it is fluid.
Yeah.
Oh, it is. Okay. So
so that's going to tell us that obviously there's some sort of inflammation. It's most likely bacterial.
Yep. And that image is taken from an endoscope that's, you're actually like you've driven through the cervix and you're looking into the uterine horn or body. I can't tell there. And normally the lining is sort of a pink, pillowy lining, and you can see there that it's kind of brownish red and then covered with that really yellow mucoid discharge. That's very abnormal. So when you talked about probably one of the first things we think about when a mare isn't getting pregnant is she healthy systemically? That can be a real problem. So our endocrine diseases and metabolic issues later in age groups, those can be real problems. And then it's interesting because even issues like in a maiden mare, some people say, well, we get phone calls of people who are having trouble getting their mares pregnant. And honestly, we get the whole gamut of ages. You would think you'd just be getting calls about the older ones, but maiden mares, their cervix may not relax enough to get a large enough dose of semen. So if they're not being reinforced bred, that may be an issue. So there's all sorts of things the history is so important, but we really look at the whole picture, the health of the mare, her reproductive tract, the breeding, the timing of the breeding. So if she's continuously ovulating 3, 4, 5 days after being bred, you need to tighten that window so that ideally she's ovulating within 24, 48 hours of being covered.
Okay. Well, that jumps into my next question about after breeding a mare. How soon should she ovulate for a pregnancy? Is it like within 24 hours, 48? What happens if she ovulates 3 days later?
Yeah, do you want?
So ideally, you want her to ovulate within 24 hours. The guidelines we use is that sperm lives for 48 hours, and so the closer to ovulation we can get the mare bred, the better we're going to be. And there's a couple of reasons for that. One is, the age of the egg, how long the sperm lives, because that's going to vary from horse to horse. There's stallions that could breed a mare and she could ovulate 4 days later and she could get pregnant. There's other stallions that breed a mare. If she ovulates 18 hours later, she's not going to get pregnant. So there's that window to deal with.
Okay. Yeah. And can you encourage the ovulation with medication?
Yes, yeah. So, and when the book size was smaller, and I've certainly talked to veterinarians and other people in Europe who are very against using medications. We use medications a lot in central Kentucky because you can induce them to ovulate once the follicle's a certain size. So, and they have good endometrial edema, we can give them a shot such as deslorelin or sucremate, you may have heard of, or HCG, which is known as Coriolan, and both of those should make a mare ovulate within 48 hours. The good thing about that is that once we have a spot, we can induce that mare, and hope most of them, 90% of them, should ovulate within 48 hours, which if you give the day before she's bred, she should be ovulating within 24 hours, which we would consider a nice window there, and we're kind of shooting for. The issue with those ovulation inducing agents is that sometimes you get multiple ovulations and so twins could be considered an issue. But at this point in time, with the experience most of the vets have, eliminating a twin at 15 days is no more detrimental than if you just had a singleton pregnancy. So twinning used to be historically a really big issue, but now it's not. So we'd rather twins than no pregnancy, for sure.
Okay. Well, that segues well into my next question about, why is it many animal species are able to produce twins, triplets, multiple births? I mean, deer do it, cows do it, but conceiving and carrying twins with horses is oftentimes considered a disaster. What is it about horses' anatomy that makes carrying twins so difficult?
It's related to the placentation. So the placenta in the horse, the way that it provides a nutrient to the foal needs a certain amount of placenta, if you will, to give it enough food or nutrition to grow properly. So if you have two of them trying to get access to a limited amount of nutrition, one of them tends to suffer. And so typically what will happen is you'll lose one sooner than the other. And then in a majority of cases, you're going to lose both of them because of not sufficient nutrition. If they do make it to term, then you worry about a dystocia, because horses have long necks, long legs, and you're trying to get 8 legs and 2 heads and 2 necks out of an opening that's designed for one set of those.
Yep. And they also, if they make it to term, a lot of times from an athletic perspective, they have been restricted somewhat in their growth, and they're usually not viable as an athlete. And so that's the problem people ask us, because you'll see something in the news about twins being born, and what doesn't this happen more often? And if you look at the studies, 90% of them result in either loss or something very detrimental to the mare. And so that's why and there might be a tiny proportion that make it, but you're, as the vet, faced with making the right decision for the mare and the pregnancy. And it definitely is the right thing to pinch the twin and then just go back and breed them.
And pinching the twin, I don't think we have any images of that. Can you explain what that is? I mean, you're doing a scan at 15, 16 days, and you see two pregnancies in there.
Yeah, so twin, basically, when we look at anywhere from 14 to 16 days, it's really cool. The equine embryo is sort of bopping around in the uterus, contacting all the different sides to let the mare recognize that she's pregnant. And then you have 2 of them. So when we scan them, we'll see what we call the embryonic vesicle. It looks like a little black circle, and it can be anywhere in the uterus. It doesn't matter which side she's ovulated on. When we find 2 in general, because it's the mobility phase and they can move, it helps us because we can actually manually push that. As we sort of push down on the uterus, you can guide one of the twins, usually the smaller of the 2, up into the tip of the horn, and then you just put pressure on it and it will rupture. And the other remaining twin, 90% of them go on to full. So it's a procedure that, with experience, and various people use different medications that they feel manage the inflammation, but if it's done gently and quickly, it's usually without any issue.
Okay, so it sounds like it's fairly common.
Yeah.
Oh yes. Yep.
Okay.
Probably
So
20
other than twins, what other issues can cause a mare to lose her pregnancy either early or even late in the pregnancy? Because that's always very sad and difficult to deal with.
So there's a variety of things. Early pregnancy losses are usually due to inflammation. So does she have an infection, or is she aspirating air and causing irritation that way? There's a genetic component to some of the early losses. There's a veterinarian at Cornell that's really looking into that, and I think we'll have some really interesting information come out of that. Further on, I think Dr. Snowbridge can talk about later pregnancy losses.
Yeah, once you get past kind of the 60 days, we typically don't see as much loss, and those usually would be from infectious causes. It could be that the uterine environment, so if a mare has a very scarred uterus, usually they'll lose the pregnancy earlier than 60 days, but they may have adhesions in the uterus or some anatomic difficulty that as the pregnancy is expanding, it can't do so normally. Those are more rare. And then we have infectious diseases that we try to vaccinate against, such as herpes, leptospirosis. And those, if a mare is unvaccinated or has her immunity to it has gone down, she may be susceptible, and those can cause abortions quickly. We also have sort of low simmering infections. So if the mare has a bad cervix that can't form an adequate seal, bacteria may get in there and start an infection, or we call that placentitis. And that can develop honestly at any point in gestation, but usually we start to see that a little bit later. And then we also have another type of placentitis called nocardiaform placentitis that we see again later in pregnancy, usually on the bottom part of the pregnancy. And so those are all things that we're looking for. And we do, with problem mares, really recommend looking at them more frequently, because sometimes you can identify that something is going wrong and intervene rapidly before you have so much pathologic change that the pregnancy is not viable.
Okay. So you mentioned placentitis. I was going to ask the question later, but let's go ahead and talk about it now. So what exactly is placentitis? I've heard the term, and we actually have a photo that we can bring up that shows an image of what placentitis is. So can you give us a little more of a general explanation of what it is? Is it an infection within the placenta?
So placentitis means just inflammation of the placenta, and the placenta is the interface between the fetus and the mare, the dam.
Okay.
So
right.
Anything that compromises that can cause inflammation in the placenta. So if the fetus has an umbilical cord torsion, that may cause edema. But usually when we're thinking about placentitis, we usually are thinking about an infectious cause. What you see here, this is the surface that the foal would be in its amniotic sac, and where the blue glove is right at where this is touching the cervix. So this is the allantoic surface, and that gray area, it actually lost all of its blood supply. So this pregnancy was ticking along just fine. The mare waxed up, and we were watching her with ultrasound and couldn't really figure out what's going on, and it lost all its blood supply there. So this is basically like the cervical pole lost all its blood supply, and the inflammation that resulted was what killed the foal. And so ascending placentitis, where it comes through the cervix, looks a little bit like this, but usually you have a lot more debris or pus, and it's the inflammation from that process that affects the foal adversely and ultimately is what will terminate the pregnancy. So our goal in looking at them is to try to identify changes, thickening of the placenta. A lot of us, you'll hear us measuring the thickness, saying that's normal or not, or what do the fluids look like? Do they have a higher density? Because that's not normal. So those are things that help us assess. None of them are a gold standard, yes or no, this is great, but they help us determine how compromised the pregnancy is.
Okay.
I don't know if that explains it yet.
That helps, yes, for sure. So, okay, one more question before we watch the video. So during the foaling season, we'll occasionally hear or read about a famous mare delivered her foal, but died from complications of foaling. So, and usually you don't get details on what that was. So what are some of those life-threatening complications that can happen when a mare is given birth?
So the biggest one that'll occur is that they'll rupture a uterine artery and they'll bleed out. And
Okay.
so the uterine vessels are within the broad ligament. So that's the structure that essentially holds the uterus up. And when that vessel ruptures, they'll bleed into the broad ligament. If they're fortunate, it'll just stay in the broad ligament, and then it'll clot and form a hematoma, and they'll be uncomfortable, but they'll survive. But if it ruptures the broad ligament, all the blood is just going to go into the abdomen, and then they're going to bleed to death.
Okay.
Another thing that could potentially happen would be that they prolapse their uterus. So in the foaling process, they're pushing extremely hard to get the foal out, and if they continue to strain, they can prolapse the uterus, which in and of itself may not cause their demise, but it can also cause ruptured blood vessels, and again, they can bleed out. And then finally, another thing that we would see is that they prolapse intestines. So the intestinal tract would come out through the rectum, and when you have that occur, blood vessels that are holding it in place and supplying it are torn, and so that tissue is non-viable.
Okay. All right. Appreciate that. So now we've got, do you want to add anything else, Dr.?
No, that's good. It is a really beautiful process. It's not all bad.
Right. Well, we've got a foaling video to show here, because I know most of them go without incident. So.
Right. The majority of them are fine.
Yep.
Yes. Okay. So now we're going to watch a video of Dr. Sheeran examining a variety of brood mares at different stages during the breeding season. And along the way, we'll pause and we'll talk about those procedures to kind of give the audience an idea of what we're doing. So let's go ahead and start that video. And we're going to start off, I believe, with the mare that you're going to do a spec and a culture on. Is that correct?
Yes.
That's kind of the whole start of the process. You have to get a clean culture out of a barren mare before she's breedable. So this tube that you're inserting, looks like you've got a flashlight to be able to see.
So we have a pen light there, and then what we're doing is we're examining the cervix to see where it's located within the vagina. Is it off the floor? Is it on the floor? Is there fluid present? Is the mucosa in there? Is it pink as it should normally be for a mare that's in heat? Or is it red and angry? Or is it pale? Does the cervical mucosa, the vaginal mucosa, match up with what we see rectally? We tried to get an image here, but unfortunately it focuses on the pen light, not on the
yeah. Okay, well, we got a little bit of a view. So now you're
using uterine culture. So the swab that we're putting in is a guarded swab. So there's a cap on the end to protect the swab itself. And then I'm using the speculum to find the cervix and pass the swab through the cervix. And then I push the swab in, and it pops the cap off, and we get our sample of the tissue. Now I'm spinning the outside, and the cap is picking up cells. So we'll get a uterine culture. So we'll look for bacteria and inflammatory cells. The culture will show us if there's bacteria present, and then what we'll do after that is a cytology. So the cap there, I'll tap it off onto this microscope slide. So any of the cells that we picked up will be on the slide, and then we'll look at those under the microscope to see if there's bacteria present, make sure that there's the epithelial cells present, and see if there's any inflammatory cells.
So every barren mare needs to have a clean culture before she can be bred. Is that correct?
Yes.
Okay, so the second part is we're going to scan for cysts within the uterus of a mare. So let's go ahead and play that part coming up. And you can stop it and tell us what we're looking at here.
So if you can stop it right there. So a pregnancy in a mare looks something similar to this. It's a nice, crisp, round, black circle. And in this mare, we were examining her for pregnancy, but we knew that she had cysts. So what we did is we mapped her cysts. We scanned her when she was out of heat, but had not been bred. And we drew on a little image of the uterus. There's a cyst here, there's a cyst here, and how big it is. And then we can go back and refer to that when we're checking the mare for pregnancy, so we don't get confused. call a cyst a pregnancy or a
So
pregnancy.
these cysts are stationary within the uterus. They don't move around.
Correct.
Okay. And can they be removed?
Can they be removed? Yes, they can, and a lot of it depends on how many of them are present, or if the mare's had problems with maintaining a pregnancy. As we've talked about earlier, the embryo will move around within the uterus to signal to the mare that she's pregnant. If the mare has a lot of cysts, there's a chance that that embryo is going to get hung up in the cysts, not be able to move around, and not be able to signal to the mare that she's pregnant. So that may be a mare that we look at 14 days and see cysts with a pregnancy next to it, and come back at our 16-day check and find that there's no pregnancy there. And it may
So
be
in 2 days, you can tell a difference in that pregnancy in a 2-day period.
So pregnancies grow at a remarkable rate. So
Wow.
at 10 days of pregnancy, the pregnancy is probably 1 or 2 millimeters in size. When we come back at 14 days of pregnancy, it's 17 to 18 millimeters in size.
Okay.
Come back a couple of days later and it's 25 millimeters.
Okay. So we'll finish up this video, and then we're going to move on to a mare who I'm assuming she didn't have a clean culture, and you're performing a lavage. Is that correct?
Well, this is actually a lavage of a post-foaling mare. So
Okay.
I typically would examine mares 5 to 7 days after they foal, and we'll do a vaginal speculum exam, make sure everything looks okay in there, see if there's bruising, things like that. And then we do a rectal ultrasound exam. And this mare had a large amount of fluid still in her uterus 5 days after she had foaled. And so
Okay.
we're lavaging that out.
So go ahead.
Go ahead.
Well, I was
So
going to
it's
ask
just
if a mare does have a bad culture, do you do a similar procedure to flush it out or clean it out?
Yeah, so it's just the tubing and the size of the fluids that we use are different. So this is a large bore tube, so we can get a lot of volume in and a lot of volume out quickly. Plus, if there's debris in there, it won't plug up your tube. The tube that we use for a mare with a dirty culture is smaller in diameter, and we put a smaller volume of fluid in there. We use 3 liters instead of 5 liters. But part of the treatment for a mare with an infection is uterine lavage. Then
What we were seeing there was you put the fluid in, however many liters, and then it comes out.
Yes, sir.
Okay. Okay. So now we've bred a mare, or we're about to breed a mare, and I think this next part, and we're scanning for breedable follicles. So let's go ahead and look at that.
20's on the left. So that's a large follicle right there.
Okay.
2. And if you can stop it there,
Yes.
if you see all of the swirliness, if you will, to the uterus, so that the band of tissue going from low, there you go, that's the uterus there, and then the sort of different shades of gray is uterine edema. And so as a mare comes into heat, she'll start with a low amount of edema, and close to ovulation will have a large amount of edema. And we use that in combination with the size of the follicle and how tight her cervix is to determine when the appropriate time is to send her to the shed.
Okay. And I thought I picked up you had measured one at 20 and one at, was it 40?
Yes, sir.
Okay. And which would both of those be breedable?
No, the 40 millimeter would be the breedable one. So mares will ovulate follicles between 40 and 55 millimeters in size. And so, as Dr. Snowbridge mentioned earlier, when we give them the drug to induce ovulation, we want them to have a follicle greater than 35 millimeters in size, but they also need to have uterine edema and a relaxed cervix. And if they have a teaser on the farm, then we want them to be teasing as well.
Okay. And if the mare had 2 40s, you could actually have a double ovulation, I would assume.
Yes, and if we're using the ovulation-inducing drugs, it's more likely that we're going to get a double ovulation.
Okay. And it looks like we're doing a scan on another mare here.
Yes.
$25.20's on the right.
So that's a pregnancy.
Okay, so we'll stop. Yeah, okay, so we went a little further there. So you said on the right, what are we talking about? Right or left? Right side of the uterus, left side of the uterus?
Which side the ovary is on. So when we're following a mare to determine when she's ready to be bred, we want to know what side the follicle is on and how big it is. So I follow my mares every day, but there's some cases where mares will go from one clinician to another. And so you want to have the paperwork to tell them this mare has this size follicle on this ovary so that we can follow the progression easily. And it's pretty standard that we'll go left side, right side, edema, fluid, and surgery.
And I assume somebody's recording that so that when you come back a day or two, they can read back that you had this on the left, this on the right. Now, where are we? Is that correct?
Yes. It varies from farm to farm. My technician rides with me and she keeps track of that for billing purposes and then for us to keep track of the mares. Some of the farms will have detailed records as well.
Okay. So the mare's been bred. It's about 16 days. We're looking for pregnancy. So is that what we're seeing here?
Yes, sir.
So where should we stop to get a good view on that? Not yet, not yet. We're right about a little further?
A little further. That's good.
Okay, so go back just a tiny bit, because what I'm looking for is that white, I call it a halo at the top.
Yeah, the bright white line at the top and bottom. And it's specular reflection, and it's just a relationship to the way the ultrasound waves penetrate and bounce off of the fluid there. But that's one way to determine the difference between a pregnancy and a cyst.
Okay, and I would assume if you see one, call it pregnant, you're still looking to see if there's not a second one in there somewhere.
Correct.
Yep.
Correct.
And that's where, would it be at this stage, if you found a second pregnancy, you would determine one of them needs to go?
Yes.
Okay. And you had mentioned earlier, these things grow rather quick. So if you came back in a couple days, would this pregnancy be much different?
It'd probably be double in size.
Is that right? Wow. Okay. Okay. Very good. So let's move forward to the next screen.
And we use the size, when we know when the mare ovulated, in our minds, we have an idea of what it should look like at different stages. So if it looks very different, that might be a clue to us that this is not a healthy pregnancy. And a lot of, once we establish that they're pregnant, we want to make sure that progresses normally, developmentally. So there's different.
Okay. So if you're looking at a 16-day scan and it appears she's pregnant, but it seems small, that would be a concern?
Yeah.
Okay.
If we were 17 days and it was only 8 millimeters, that would be very concerning. Yeah.
Okay.
Unless she had another ovulation.
Okay.
So that's where we go back to the records then and look. So we bred her off of a 45 millimeter follicle, but on her other ovary, she had a 30. So did she ovulate that second one 5 days later?
Oh, very good. Good point. Yeah.
You're bred to a fertile stallion. There's that possibility that it was a.
So in that case, it really wouldn't be a problem. It's just that the first one didn't catch and the other one did.
Right, but it would require follow-up examinations to make sure it continues to grow in the normal fashion.
Okay, so all we saw on the screen was a large circle. At what point can you look for a heartbeat? Because I think that's what we're going to see on the screen here in a moment.
So you can see, if depending on how detailed, how good your ultrasound machine is, usually even at 21 or 22 days, you can see a little bump at the bottom of the circle and you'll see a little flicker. Usually we look at the heart rate around 28 days because it's also developmentally split right through the middle. And you should be able to see the heart rate really pretty easily from 25 days until they're born if you're using the ultrasound.
Okay,
so,
well, let's go look at this video, see if we can we see a heartbeat.
The head, the neck, the fold disappeared. There it is again. There's the heart beating.
Is that it up at the top? That little.
It's hard to
see because this isn't flowing very smoothly.
Right. Okay. All right.
Should be right in that area. Yeah.
Yeah.
Okay. So this is at about 21, 22 days. Okay.
Is the heart beating?
Oh, this is further along. I want to say this is like a 90-day pregnancy.
No, 90-day. Okay, this one here is okay.
Yeah.
So, at what stage then could you fetal sex this pregnancy and tell whether it's a filly or a colt? Because that's pretty common.
Yeah, so you can look at them. There's a thing called the genital tubercle, which stays in sort of a neutral position up till 55 days. So the first window that we can actually determine the gender, the genital tubercle will either move, if it's a colt, from kind of this middle position to right behind the umbilical cord, which is where the sheath would be in the penis, or if it's a filly, it obviously moves under the tail head. So we look at it, we can start fetal sexing 56 days to 70 days is the first window. And then there's a period where the pregnancy gets big and starts to drop over the pelvic brim, but it's not quite big enough to get really good contact with the abdomen. So it's very difficult to fetal sex from 70 to 90 days. So we say there's a second window, about 110 days. And you can say that it's easy to do from 110 to 120, but you can actually fetal sex much later into gestation if you know what to look for. So there's a second window, generally considered 110 to 125. But there are some people, and you can look even later in gestation, up to even 280 days. You can look for things like the scrotum or the gonads that can tell you. And so that may be helpful around the sale and stuff if you're trying to decide to sell an animal, but you didn't sex her in that earlier window.
And is that, I would assume that's fairly accurate if you're going to declare that the mare's carrying a colt.
Yes, what we would do if we have any doubts is we would say we can't make the call. In order for us to call that it is one of the genders, we have to have a negative, we call it a negative view and a positive view. So we have to see what we would expect to see for a colt and look to see if it were a filly, are the structures there? And if they're not, then that's sort of double confirmation. We always say, most of us who are doing it, we do not want to ever hear that we got it wrong. And we would certainly say if we felt there was any question that we weren't sure. The certificate you get for the sale does say that we cannot say for certainty, because there's obviously things like the hermaphrodites and other things that happen. But I would say 99% of the fetal sex certs you get are going to be what they should be. Okay,
very good. Good to know. All right, so we're almost done with this video. Let's go ahead. I think we're scanning one more time, late in a pregnancy for, so there's more of that. Checking the.
So she was like 48
days, yeah.
So that pregnancy, the last one we saw was about 48 days.
Okay.
Fluids are normal. C-top is 8.9.
So this is a mare we're scanning. We're just doing a screen of the placental thickness and the fluids.
Okay.
Good.
And there you can look to see what the cervix looks like, if there's fluid in the vagina. It's a very important area of the placenta. And so a lot of us do those scans to look and see.
Okay, so work's been done. Mare's pregnant. We've gotten through the winter. It's about time to foal this baby out. So it's 11 months later. So we've got one more video that shows the actual foaling of a baby. So let's go ahead and show that. And it looks pretty professionally done here. So we're starting off. It looks like we've got the two legs and the head positioned properly.
Yep, and this would be after the water has broken, so you would see kind of a rupture of fluids, and the foal should be coming out in that white sac, which is the amnion. So she's putting a little traction there, and you should have the two front legs and the nose and head right above.
Okay.
The other thing to note is that the two front feet are not parallel. There's one further ahead of the other, and that's how their shoulders fit out. You try to get both of them out at the same time, you're going to tend to get stuck at the shoulder.
Okay, well, let's pause here for a second because, and I've heard of mares getting to this point and you just can't find a way to get the foal to come out. Is there something going on inside that's causing this foal to get locked up? What should the handlers do? Should they get the mare up? Should they just keep pulling? What are your thoughts?
It kind of depends on how far out the baby is. Well, from what I haven't seen this video before, but they can get hip locked is one of the things. And so applying lube, if the mare is not well lubricated, that may help, you know, around the vagina. I would not recommend trying to get the mare up. What I would probably try to do if it was hip locked is just rotate it 15 to 20 degrees and apply traction. The other thing you can do is you can sort of, since the ribs are out, is bring the foal down so that the angle that you're pulling is not straight back, but more in an arc that's coming down behind her hind feet.
Right.
If you're really still continuing to have trouble, the reaching your hand in, which in this situation is very difficult, but you're feeling for hind feet. Now, this foal is farther out, then sometimes they'll be stuck in a dog sitting position where their hind feet are on the pelvic brim, and those are very difficult, and would need to go into the clinic to try to get resolved.
Okay, so let's continue with the video. It looks like they're pulling in a downward towards the mare's hocks.
Yep.
And the foal just slides right out.
And so it's not really a strong, hard pull, but more of assistance than anything else. So
yeah, it seems like as the mare pushed, they maybe gave her a little bit of help.
Yes.
Yeah.
All right. Well, bright and alert.
Beautiful. Yep. And you can help the foal by putting it in sternal, just like that. That allows its rib cage to kind of open and dry it off or stimulate it. But that is a very beautiful, alert little foal.
Great. Wonderful. Yeah. All right. It happens thousands of times a year.
Yes, it does.
All right. So, all right. So every now and then, you know, you hear about a dystocia in a delivery. What does that term mean? And you know, I've heard it before. Maybe you can just explain what that is.
So dystocia is just a difficult delivery. And so there's a variety of causes for it. You know, the thing that Dr. Snowbridge was talking about, the dog sitting position. So the two hind limbs get, and it can't come any further. When we're talking about the two front legs not being parallel, they can get hung up at the shoulders. Sometimes when they're coming out, if one front limb is way further ahead of the other one, they may be hung up at their elbow. The other issue that we have with the horse is that it has such a long neck that the head can be down or to the side. And so the feet come out, but there's no head presenting. And, you know, those things some of them you can correct on the farm, and some of them they need to come to the clinic to be correct.
So the term dystocia is a general term for a difficult foaling, and there's a whole variety of things.
Yes.
Yep. And that may even be something like the mare not pushing. It can be lots of different things that can cause it. Yeah. And probably the most important thing is having experienced foaling crew that recognizes when something is going wrong, because the horse is very unique in that the window from when the water breaks to when the foal comes out should be about 20 minutes. And there's a progression you want to see. And if that's not happening, intervention is needed. So people who are first time foaling, you know, maybe they have no experience with it. I recommend, you know, considering foaling the mare out somewhere else. I know people want to see the miracle of birth, but there are a lot of things that can go wrong, and that's not fun if you don't have the right people to help you.
Well, and based on what you just said, if a mare's if her water breaks, you know, we know it's imminent, she's going to foal. I would guess it's unusual for the vet to get there in time to deliver the foal.
Correct.
That's
so
absolutely
you really
right.
need to have good handlers or a good farm that knows what they're doing.
Yes.
Yep.
Okay.
And having a hospital or a plan for if it's not progressing, getting a horse into the hospital. We're fortunate here in Lexington because a lot of the hospitals are 20 minutes away. So even if it's starting to go wrong, most people will load it up on the trailer and get it into a place where they can either put the mare under anesthesia and manipulate it or get her to C-section. And I think that results in a lot more of the foals surviving than if you're 2 hours away.
Okay. Well, I have one more question, and then we're going to go to the audience. So audience, if you have a question for either veterinarian, please submit them with the Q&A button. So I've got one more question, then we'll take that break, and then we'll go to the audience questions. Okay. So if a foal was born, we'll say a month early, are there developmental problems being born that early, or is everything okay if they come out a little bit early?
Want me to do it? Okay. We're a good team. We're like, end of the day, who wants it? So one of the things that's unique about the equine species is that the surfactant in the lungs develops basically in the last few days of gestation. So I know we've heard of humans that, will have their baby at 24 weeks or halfway through the gestation. That can't happen in horses because their lungs are not developed. And so really, we all kind of as a benchmark, if it's before 320 days, it's very unlikely to have a good prognosis for survival. One, because the lungs cannot be matured appropriately. And the second thing is that the bones are not ossified. And unlike humans that can sit in a crib, a foal needs to be able to get up and move around. We can protect them in some ways, but a lot of times if the bones are too immature or they don't have enough bone laid down and it's just cartilage, it'll result in crushing. And that can be kind of a career ender for a horse. So there are also many other complications. Sometimes they would be called like a dummy foal, or they haven't gotten enough oxygen.
Right.
And that can be an issue and requires so much maintenance, and they're more prone to getting septic or infections in the blood. So there's a lot of complications if they're born a month early. Sometimes if they've had a disease process that may have kind of sped up the process of maturation, some of those foals are already in kind of a bad environment and do mature a little faster. So I'm not going to say that there aren't foals that are born a month early that don't make it, but they're fewer and far between.
Okay. All right. Good to know. Didn't realize that.
Yeah.
Okay. So we got a kind of a late start. So we're going to go ahead and jump into the Q&A, but we're going to pause for a minute. We've got a quick ad from West Point Thoroughbreds. And while we sort through the questions, let's watch that, and then we will be right back. Okay, first question from the audience. Can a torn cervix be repaired? So a mare foals, has some problems, but everything goes okay in the foaling, but she's got a torn cervix. Can it be repaired? Can she go on and still be a brood mare, or is that the end of her career?
It's going to depend on the severity of the tear and how badly the cervix is damaged. So if a big chunk of the cervix is missing, say from 2 to 6 o'clock, then that's going to be more difficult to repair as compared to, say, a laceration at 6 o'clock to put that back together. But yes, they can be repaired, and they can go on to carry foals to term following that.
Okay.
And people will ask how important is it to repair the tear, and it also depends on the severity. If you have a large piece missing, that cervix can't form a barrier and prevent the uterus from getting infections. So, some people say, well, I don't want to spend the money to repair it, but very quickly you're going to be spending that money on trying to clean the mare up, and, really investing in that cervical repair is money well spent if you need to, and your vet has to assess that and look at the mare in diestrus when she's out of heat so that the cervix is closed and acting as a barrier.
Okay, good to know. So next question, when extending the breeding season for a mare by putting her under the lights, can this be done continuously or does it harm the mare in any way? Are there any downsides of this artificial breeding window?
So it doesn't extend the breeding season. It takes the breeding season and moves the whole thing forward. So it doesn't do this, it does that. And so there's not a disadvantage to doing that. Putting the mare under extended day length, 365 days a year, there's not going to be a benefit to that. And sometimes it may throw them out of whack a little bit in that it doesn't advance it like you want, and it may actually retard it.
Okay. So next question, what are the pros and cons of full heat breeding?
Okay, so one, I think it's important to, when you're thinking about full heat breeding, to compare different breeds, because there are some breed differences. In some breeds, full heat breeding is very fertile and the mares seem to involute well. And that's not a terrible idea. And in nature, that happens very often. In thoroughbreds, there was a really nice study that showed that mares that foaled, it takes them about 70 days to get to the same fertility as a barren or a maiden. And that was a study done in central Kentucky. So when you think about a full heat breeding, they tend to have, their uterus may not be, it may have too much inflammation, it may not have involuted, they may be urine pooling. You really have to look at the mare, and certainly we try to avoid it in general because of that study. Oftentimes you can get a pregnancy, but the losses are higher because the uterus and the uterine environment is not ideal. So try to go for a 30-day breeding. But that being said, there are mares that look excellent and they involute very well. They don't have excessive fluid. The uterus has returned to a more normal anatomy. And oftentimes we'll let them go through the full heat and short cycle them so that we may be breeding them maybe 3 weeks after foaling or 2 weeks. And then towards the end of the year, we look at them and maybe we're running out of time. We may consider full heat breeding. And when we do, we really try to make sure that the mare is ovulating about 10 days post-foaling, because it's been shown that if you can get to 10 days, that your pregnancy is more likely to be viable, just based on what needs to happen. But it really is, in my opinion, kind of a waste of time if you have excessive fluid and evidence of inflammation. And potentially take it. Not everyone does a culture and cytology at the full heat, but if you were trying to make the decision on that, I think that would be something that would be helpful to show you how the environment is if you were considering it.
You want her to be perfect. You want her to be perfect when you breed her on a full heat.
Yeah.
And if you skip a full heat, can you do something that's called short cycle the mare to get her to cycle back and be a little bit better shape to breed?
Yes.
Yep.
So you're going to advance. So in a normal mare, if we did nothing, they have their full heat, which ranges anywhere from 7 to 14 days post foaling, and then they have what we call a 30-day heat, which is typically about 30 days after they foal. So what we can do is once they ovulate, that first one is 5 to 7 days after that, give them a shot of prostaglandin to bring them back into heat. So you're going to breed them a little bit sooner than the 30-day heat. Because our goal is to not have them back up in the time that they foal. So if they foal in May, we want them to continue to foal in May, or if we can move them forward a little bit, we want to do that rather than having them back up into June. So you need to get them bred as quickly as possible.
Okay, good to know. So a question from the audience, what might cause a dummy foal? For a foal to, we've heard the term that you've got a dummy foal. What exactly is that and what causes it?
So there's a lot of reasons, but kind of the basic thing is that somewhere in the delivery process, it's thought that the foal has had a lack of oxygen for a period of time. And that can be because the placenta separated or the baby got stuck, the foal got stuck in the birth canal and the connection of the placenta was not good. We certainly see it in compromised placentas. So maybe the foal is already compromised to begin with and can't tolerate that brief period when they may not be getting oxygen as they're being born. And what that does to the foal is it can cause their GI tract not to work well. So when they nurse, they basically they can't pass the milk through. You may see them refluxing. Their attitude is not normal. They don't stand and nurse within the 3-hour time period post-foaling. So we kind of have a time period after foaling, the 1, 2, 3. So 1 hour after foaling, they should be standing. 2 hours, the foal should be nursing, and 3 hours, we'd like to see the placenta drop or the mare to pass the placenta. So if your foal at 4 hours is lying in the straw and not responsive, that's not good. So there's something wrong with that foal's mentation. And there's many different symptoms that they see, but in general, it's supportive care. So making sure that they're receiving fluids. Because they're not nursing, they are not able to get that colostrum. So making sure that we can get the colostrum and the antibodies into them. And they may be prone to getting infections because of their immune compromise. So a lot of our hospitals, when we're taking care of these dummy foals, or you'll see your vet do it in the field, it's sort of supportive care, antimicrobials, providing nutritional care until that foal can get back on its feet. And they use a lot of anti-inflammatories at times to help, the systems basically regulate after this insult, I guess would be how I would describe it.
Okay. And that kind of segues into the next question about a red bag birth, what that is and how that compromises the foal.
So a red bag is essentially premature placental separation. And so in the normal foaling process, the pressures cause the placenta to rupture, and then she breaks water, and then we'll see the amnia in the white bag. And in a red bag, things come out and the placenta doesn't rupture, and so you see a red bag. It's the tissue. If you remember the picture of the placenta we saw earlier with the red side, so that's what you're going to see, and there won't be foal, there won't be the white bag, it'll be that red. And in those cases, that has to be cut open and the foal delivered quickly. Because it's lost nutrition and its oxygen supply.
Yeah.
Okay. So last question. I like this question. Would you recommend mares foal outside or inside in a stall?
Outside.
Outside, and why?
Well, so there's a variety of reasons. Foaling in a stall. So typically, a foaling stall is a foaling stall where lots of mares will foal. So the ability to get it cleaned and disinfected between foals, there's an issue with that. In my opinion, mares that foal outside, the foals seem to get up faster. They seem to nurse faster. There's obviously less chance of contamination as long as they're not foaling in the mud. But you want them to foal in a nice grass pasture.
Okay.
And the mares seem to be able to position themselves well, and honestly, the less stress on the mare, the better. I know, the value of the horses means that we want to supervise and be involved and make sure everything goes well. But the farms that I see the fewest cervical tears and fractured ribs, they do less, honestly. I mean, I think that, and the mare is less stressed and it can progress more normally.
Okay. Well, I remember years ago, we had a mare due, and my wife was walking back to the barn to check her out in the field, and she calls me at the office and says, "We have a baby." Standing there nursing. So it can happen, and hopefully all good. So that wraps up our Q&A period. I really want to thank both veterinarians, Dr. Sheeran, Dr. Snowbrick, for your time, your insight. Just really, it's very valuable. This will all be recorded so other owners can have an opportunity to learn from this. So I really do appreciate your time. Apologize for the technical issues early on, but I think we got through it okay.
I think so.
Absolutely. Thank you for the opportunity to talk to you guys.
Yep. Thank you for having us.
Thank you. So audience, if you have a follow-up question for either one of the veterinarians, just send me an email and I'll be happy to pass it on to either one of them. So also like to thank our panel sponsors again, Airdrie Stud and Equiloom. Most of all, really want to thank our owners, because without your investment in racehorses and mares and foals, we simply don't have a product or an industry. So we greatly appreciate that you took the time to be with us today. Now, I would like to let you know that our friends at Toba have a clinic coming up at the end of this month, and it is a breeding and a breeding clinic, May 30th and 31st. I think you see it on the screen. They're going to be at a couple of different farms, got a lot of great speakers. So if you want to learn more about breeding, this clinic takes place in Lexington, and just go to toba.org to find out how you can register for that. So those are our friends from Toba. Next month, we're going to be back on June the 10th on the topic of what are we doing in the industry to promote thoroughbred ownership. So that's going to be a real interesting panel. Until then, just be safe and enjoy the next two legs of the Triple Crown. Thank you again, both doctors.
Thank you.
Great.
Right.